A breath of life understanding intubation. Breathing is something we often take for granted, yet it is fundamental to life. When illness or injury threatens our ability to breathe, medical intervention becomes crucial. This is where intubation comes in. Intubation is a procedure to establish an airway when a patient cannot breathe on their own. Imagine a tube acting as a direct pathway for air to reach the lungs. That's essentially what intubation does. A flexible tube, called an endotracheal tube, is inserted through the mouth and into the trachea, bypassing any obstruction. This secures the airway and allows for mechanical ventilation if needed. Intubation is a common procedure in hospitals, particularly in critical care settings and emergency rooms. It can be life-saving in situations where a patient's breathing is compromised due to various reasons such as trauma, severe asthma attacks, or drug overdose. Understanding the importance of intubation is crucial for medical professionals. The ability to secure an airway through intubation is fundamental to providing life support. Mastering this skill requires not only technical expertise, but also a deep understanding of the procedure's implications and potential complications. Getting ready. Preparation is key. Before even touching the patient, preparation is paramount. Just like a pilot wouldn't take off without pre-flight checks, a medical professional should never attempt intubation without meticulous preparation. This involves two key aspects: readying the necessary equipment and conducting a thorough patient assessment. First, the equipment. The intubation kit must be complete and within easy reach. This includes various sizes of endotracheal tubes, a laryngoscope with functioning blades, a stylet, a suction device, and a back valve mask for ventilation. Each item plays a vital role and must be checked for functionality. Next comes the patient assessment. Understanding the patient's medical history, current condition, and any potential challenges is crucial. Factors like airway anatomy, body mass index, and the presence of any underlying medical conditions can influence the intubation process. Having all the necessary equipment readily available and understanding the patient's specific needs are not just preparatory steps, they are fundamental to ensuring a smooth and successful intubation procedure. Finding the right position. Setting the stage. Imagine trying to thread a needle in a dimly lit room while the needle keeps moving. That's what intubating a patient without proper positioning would be like. Difficult and potentially dangerous. Proper patient positioning is crucial for successful intubation. The optimal position for intubation is called the sniffing position. The patient lies supine with their head tilted back slightly and their chin lifted. Imagine someone trying to smell something pleasant in the air. This position aligns the airway and optimizes the view of the vocal cords for tube insertion. However, not all patients can be easily positioned this way. Trauma patients with potential spinal injuries require special precautions. Obese patients may need adjustments to achieve proper airway alignment. The key is to adapt the positioning technique while maintaining airway integrity. Proper positioning is not merely a matter of convenience. It's about maximizing the chances of successful intubation while minimizing the risk of complications. Section 4. Oxygen first. Pre-oxygenation and sedation. Intubation can be a stressful experience for the patient, both physically and psychologically. That's why pre-oxygenation and sedation are crucial steps. These measures not only ensure the patient's comfort, but also optimize their physiological state for the procedure. Pre-oxygenation involves providing the patient with 100% oxygen for a few minutes before intubation. This is like taking deep breaths before diving underwater. It increases the oxygen reserve in the lungs, providing a buffer in case of any delays or difficulties during the procedure. Sedation is then administered to relax the patient and reduce anxiety. This is especially important in awake intubations, where the patient is conscious throughout the procedure. The level of sedation is carefully titrated to ensure patient comfort while maintaining spontaneous breathing as long as possible. Pre-oxygenation and sedation are not optional extras. They are essential components of safe and humane intubation practice. Section 5. A glimpse inside. The laryngoscopy. Imagine trying to find a specific book in a vast library without a catalogue. That's what visualizing the vocal cords without a laryngoscope would be like. Near impossible. Laryngoscopy is a crucial step in intubation, allowing the medical professional to visualize the vocal cords for proper tube placement. The laryngoscope, an instrument with a light source and a blade, is gently inserted into the patient's mouth. The blade is used to lift the tongue and epiglottis, revealing the vocal cords, which appear as two white bands that open and close with each breath. However, visualizing the vocal cords is not always straightforward. Anatomical variations, swelling, or secretions can obscure the view. In such cases, techniques like external laryngeal manipulation or the use of different laryngoscope blades might be necessary. Laryngoscopy is like opening a gateway to the airway. It requires a delicate touch, a keen eye, and the ability to adapt to unexpected challenges. Section 6. Guiding the tube, intubation technique. With the vocal cords in sight, the next step is guiding the endotracheal tube through the vocal cords and into the trachea. This step requires a steady hand, precise movements, and a clear understanding of the airway anatomy. Holding the endotracheal tube like a pencil, the medical professional carefully advances it through the vocal cords, visualizing its passage. The tube should pass smoothly, without resistance. Once the tube is in place, the cuff at its end is inflated to create a seal, preventing air leakage and aspiration. However, this seemingly simple step is fraught with potential complications. Inserting the tube too far can lead to one lung being ventilated while the other collapses. Accidental esophageal intubation, where the tube enters the esophagus instead of the trachea, is a life-threatening error. Guiding the tube demands utmost precision and vigilance. It's about navigating a critical pathway with the patient's life hanging in the balance.